Um, so really, those are the three main hormones that are involved in calcium homeostasis. And I have already covered the functions of calcium, what calcium does. I'm quite worried about the time that I have left. Oh dear, I actually have 11 minutes left, so I'm just going to quickly wrap this up. So in this section, I have really, this is just to supplement the calcium metabolism that I have already done. And in this section, really, I have discussed what calcium is. It's important in this functional importance in the cell, such as how it can cause muscle contraction, how it can act as a secondary messenger, how it can cause the how it works as a coenzyme to help with the function of processes such as the phosphorylation, and most importantly, which I absolutely forgot, calcium is important for a number of in the coagulation, which is coagulation, in the coagulation cascade. And really it's for the activation of factors of coagulation factors of both the intrinsic and extrinsic pathways. So really, without calcium, coagulation cannot occur. So really, this is one of the most important roles of calcium, in the coagulation cascade, which I've already covered when I covered my hematology revision lectures. I covered the coagulation cascade quite comprehensively, and I also covered it quite briefly in cardiology when I was talking about atherosclerosis. So really, this is one of the most important functions of calcium that I've forgotten. However, the calcium is also, if it enters the cell, it acts very quickly and causes very rapid changes in the cell. Therefore, its regulation is quite important, and this is tightly maintained. It's maintained at 10 milligrams per deciliter, or 2.5 millimoles per liter, and it's regulated by 3 hormones: vitamin D, parathyroid, which are released in times of hypocalcemia, or calcitonin, which is released really in times of hypercalcemia. Most of the calcium is stored in the bone as calcium phosphates, and really it readily binds to phosphate. So its regulation is also linked to phosphate regulation, as I've shown. So in the next section, I think I'll focus mainly on hypercalcemia, hypocalcemia, and perhaps the hyperparathyroidism, and then also talk about the clinical findings that will be there. Specifically, I mean the tests that one will need to undertake, and the findings from those tests, and then how the treatment will then link to the findings in that test. So I think I'll leave it there. I doubt that I'll have much time for anything else. Thank you.